Diabetes is a disease that affects 28.5 million people in the United States alone. That is approximately 8.3% of the entire United States population. It is a disease that affects people differently and in different parts of the body. Can you imagine the complications that can occur if this disease goes uncontrolled or even untreated? The outcome could be absolutely catastrophic. It is important for people to know about diabetes and how it can be avoided. With the obesity rates at an all-time high, diabetes is also on the rise. It is important to eat properly, exercise, and control food portions. All of those are ways of not only preventing diabetes, but also controlling it. What is diabetes, you may ask? Diabetes is the condition in which the body does not properly process food for use of energy. Most of the food we eat is turned into glucose, or sugar, and that is for our bodies to use for energy. With diabetes mellitus, the body is not able to process the sugars properly. There are several different types of diabetes. There's prediabetes, type 1, type 2, and even gestational diabetes. Prediabetes is the stage before full-blown diabetes. Some may show some symptoms, while other people don't show any symptoms of diabetes. Type 1 is usually referenced as juvenile diabetes and is usually associated with being insulin dependent. Type 2 diabetes usually onsets during adulthood, and most that have type 2 diabetes require some sort of medication to control it, rather than giving themselves the insulin shots. Gestational diabetes is onset during pregnancy. Sometimes gestational diabetes does stay with a woman even after her child is born, but in most cases, it does go away with proper diet and exercise during the pregnancy. What are the symptoms of diabetes? Frequent urination, excessive thirst, unexplained weight loss or even weight gain, extreme hunger spells, sudden vision changes or even vision loss, tingling and numbness in the hands and the feet, feeling very fatigued and very tired a lot of the time. Dry skin has also been known to be a symptom. Sores that are slow to heal, and maybe even getting more infections than you're usually getting. The tricky part about the symptoms of diabetes is that one person may only have one symptom, some person may have all the symptoms, and another may not have any of the symptoms that have been listed. Diabetes is often a genetic disease, and if diabetes does run in your family, it is a good idea to be checked at least once a year. This is done with a simple blood test, and the results come back within 72 hours of being processed. A lot of people wonder how diabetes can be treated. Treatment typically includes diet control, exercise, doing home glucose testing, which is done with testing strips and a glucose monitor, and in some cases, some take oral medication or even self-injected insulin. Exercise and proper nutrition play a very important role in the prevention and control of diabetes. Eating properly and exercising frequently help the body process sugars easier. Without the proper medications, diet and exercise results could be catastrophic. Diabetes can always be prevented and controlled, but there is currently no known cure for diabetes. There are often a lot of complications when diabetes goes uncontrolled. People with diabetes do have a higher risk for heart attack and stroke, and this can also lead to heart disease. It also leads to blindness and other vision problems. Diabetes can also damage the kidney, which can also lead to kidney failure. Nerve damage is also an effect of diabetes. This damages the nerves that run through the body, which results in infections of the feet and problem with the blood flow to the feet, and this can often lead to amputation of the limbs. Diabetes can also cause skin problems like infections, sores, and skin itching. Some of these skin problems are often some of the first signs that a person may be infected with diabetes. Diabetes can lead to problems with the teeth and gums. The most known teeth and gum problems are gingivitis and periodontitis. It is very clear to everyone that our health is, or at least should be, a huge concern and priority. We only get one chance at life, and taking care of ourselves is highly important. Eating a healthy diet and having an appropriate exercise plan is important to keep your health at top notch. Sometimes diabetes is inevitable. Unfortunately, we don't get to choose our genes and our genetics. It is important to embrace life even when there are complications thrown in. And it is important to know that diabetes is in no way a death sentence. It is simply a life change that requires us to make a lifetime adjustment.